Have you ever struggled to find reliable nutrition information online? I know most of you that is the question that has been on your mind. I need to find a reliable source where I can easily get the information I need. So between Google results, a lot of data out there, and a lot of sponsored content. And if you stay online and you do a lot of online research, you'll be able to actually get to know like what is a sponsored content and what is an actual real science evidence-based content. And I feel like it can get overwhelming for you as a professional, a healthcare worker, for you as a client who's looking for information. Today I'll show you the free tools I actually use for evidence-based, and I want you guys by the end of this short episode, you'll be able to know where to get trustworthy science-backed info without paying a cent. This is a life hack kind of video. I want you guys to actually enjoy, save, share, let people know about this episode and also this channel. My name is Charity Wanyonyi. I'm a certified nutritionist practicing in Kenya. I'm a mental health advocate. I'm a digital content coach. I'm also a researcher, and I want you guys to actually get to enjoy this episode. So don't forget to subscribe. Let's get to 200 subscribers. And thank you so much for anyone who is watching and anyone who has subscribed. Please keep sharing and follow me on all my social media platforms so that you can get more of this that I'm talking about. So today we're going to look at the best free tools to use for nutrition research. Yes, them one. So why does this topic matter? Just a brief context. Nutrition information online is noisy, and if you've been there, you know what I mean, and full of misinformation, myths. A lot of people, like my partner usually says, nutrition is a career where you have to beg people to listen to you, and that is the information they actually need. So if you're a student, professional, and even client, you need a reliable source of information, yes, to get factual information that will be able to help you. And having this go-to tool saves time, and I feel like it boosts confidence for you as a healthcare worker, because you know the information you're giving is by the guidelines, is by everything you need. So I'll try my best to really not talk too much, because I don't want this episode to be long. So without further ado, we are going to dive into what is the topic today. So thank you. So number one, it's the ASPEN. This is the American Association for Parenteral and Enteral Nutrition. So this is where you can get the guidelines when it comes to management of different nutrition cases in the ward, in the ICU, in the HDU, just how to calculate all those fluids. And I feel like in Africa we don't have our own guidelines, so we borrow from ASPEN. This is how it looks like. It has a lot of research, like ASPEN guideline to validity of body composition assessment, ASPEN guidelines for selection of care and central venous devices for home parenteral nutrition, guidelines for provision of nutrition support therapy in adults and critically ill patients. So I feel like we borrow from this. Yeah. Number two is the ESPEN. This is the European Society for Clinical Nutrition and Metabolism. So this is where I get most of the papers, especially when we have our sessions on critically taking care of critically ill patients. I come here and read, even when I'm bored sometimes, I come and read some of the papers that are in here. I'm just looking at what is current. You have to be up to date with the knowledge, and you can be able to download these files and read offline if bundles are your problems. You can see ESPEN practical guidelines to clinical nutrition in liver disease, ESPEN guidelines on home parenteral nutrition, expert statement on practical guidance for nutritional management of just a lot of things that affect clinical nutrition available in the ESPEN and ASPEN. So it's very, very important for you to be up to date. You can see ESPEN guidelines for chronic intestinal failure in adults. So this came here the year 2023, which is latest. So you come and download and continue reading and advancing your knowledge as a nutritionist and also as a healthcare professional. Number three is PubMed. I know you've come across this. You can log in, create an account, same as the ASPEN and the ESPEN, I forgot to say. And so this is National Library for Medicine. It's a free database for research articles. So you'll come and find what is new and what has been published in terms of the medical field. You can search, maybe you're looking for vitamin D and this association to our sleep pattern. You can come and just type vitamin D studies and immunity, nutrition, clinical nutrition, and also you can be able to download. So this is how the site looks like. You can come and read what is trending, what is not, so you can stay ahead of what is there. You can see nitrogen balance in hemodialysis patient, and last time we talked about managing malnutrition in CKD. So this will be able to just help you sharpen your skills as a nutritionist or also as a healthcare professional who's interested in nutrition. Number four is my all-time favorite, Google Scholar. This is also what I currently use for my research when it comes to my master's. It has a lot of papers. So you can say, because I'm doing diabetes, you can search diabetes milliliters, and it take you to a lot of papers that have been done, but it dates years and years back. So you can come here and say you want, because currently the university doesn't want you to cite papers that are less, like, are 5 or 7 years ago, because those are outdated and research is being done. So you can come and custom make since 2025, like you find researches done on diabetes this year, since 2024, since 2021. You can be able to just come and see what other people have been doing. I love this site so much. I love it. Like, I plug you, even if you don't want to read any of the ones I have shared, please come to Google Scholar and just look at what people are currently doing in the medical field, in the nutrition field, in any field that you like. You'll come and find most of the papers that are done. So save and bookmark Google Scholar and go and look at it. You can create a profile, create a library that you can be sending the papers that you will read later, and also you can download in the PDF form and read offline if that is what you want. Another one is Food and Agriculture Organization of the United Nations. You can also find some dietary guidelines just to establish, like, it's a basis for public food and nutrition, health, agricultural policies, nutrition education program, healthy habits. So most of my guidelines I also find, and you can see it's classified according to countries. So you can come, you can see Kenya is here. You can click on Kenya, and then it will take you to food-based dietary guidelines Kenya, and then there's the national guidelines for healthy diet 2017. This should be an area of interest if you're looking into chiming, because 2017 is almost, I don't know how many years ago, guys. It means we need something new and something that relates to what is currently happening here. So you can come and find them and also read. And they've just summarized basically what is on the food guide, the message for healthy eating. Even if you don't want to read the whole document, you can just come and read these 9 things and apply it to your practice, or apply when you're telling your patient or advising them on what a healthy diet is. Apart from FAO, there's World Health Organization, WHO, like what is recently been quoted. You can also come to their website and just find everything you need about nutrition. This is the overview, or they're telling you the importance of nutrition. And also when you come here, the latest news that are being done all over Africa and the world. You can see global hunger declines but rises in Africa and Western Asia. This is the UN report. So you can read and find out why global hunger is reported to decline, but this rise in African and Asian, these are developing countries. You can come and read and maybe find a research paper you can write on the reason why, because we're in that country. We're in a country in Africa, so you can be able to actually highlight what can be causing the rise in hunger. This World Health Assembly recommits to global nutrition targets. You can come and read more on the global nutrition targets and marketing regulation. WHO unveiled board commitment to nutrition and growth summit. So any summit, any report that is done, you'll come. There are publications. WHO anemia estimates findings. So you can come if you're interested in anemia. You can download and read more. Levels and trends of child malnutrition. This is in partnership with UNICEF, World Bank. You can download and read more. And communicable diseases progress monitor. This now will tell you the actual true picture of the status of NCDs. Reports of the 10th meeting of WHO strategic and tech. It has a lot of things you can read. Just a lot of things that are being done when it comes to medical and nutrition field. So here is nutrition. You can click and read more. You can find infographics. You can share. If you don't know how to make posters, they've already made the posters. As long as you tag them, you can be posting these posters on your platform and just sharing your 2 cents. They have videos if you don't want to read. There are videos you can listen to, and just they have their podcasts. You can listen to them. Imagine that 101 podcast. So you can come and listen and know what is currently happening. So here is food fortification, anemia, infant malnutrition, obesity. Like, it has a lot of things. So guys, you can't use the excuse that there's nothing for you guys to read. I actually, apart from Google Scholar, WHO is also my go-to website. This is another tool we learned in campus, I think, in the nutrition assessment. Was it in 202, like when we were in second year? I think if you're a student and you're watching, leave it in the comment section. I think it was second year where we did the nutrition survey third year. So you can download the app, and nutrition survey basically just helps you know, like, how to analyze data. I mean diets. If a client, you've collected your 24-hour record, you can come and input in the nutri survey, and then it will calculate for you the overall caloric daily intake of the client, so that you know if they're meeting the minimum requirements or not. So I feel like also Nutri-Survey has really expanded, because this is also what I use to analyze my data. It has like Kenyan meals, like, in detail, so you can just go through this. I think I will break this separately in very short videos on how to use them. If that is what you want, you can leave in the chat box. You can break them down. So if I had time, I would have taken you just inputting my own meal throughout the day, so that you can see if I'm meeting the necessary requirements in terms of the macro and the micronutrients. You guys know what's the importance of Nutri-Survey, so I'm not going to walk you through, but you can come to the Nutri-Survey website and download it to your laptop, and then you can continue just using it. yeah, I feel like that is it. And lastly, guys, I know I said it's not going to be long, and we're already, I don't know how many minutes in. So when I want to know what is happening currently in Kenya, I come to the Ministry of Health website to just find Kenyan guidelines, standards, policy, and all the things. So if you need, you can just come here and see. This was published in January 2025, National and County Health Budget Analysis. If you want to know budget allocation, we were talking about this on our last live with Lillian. Jacob and Arthur, and we are talking about how nutrition is not being considered when it comes to budget. So you can come and read here and know more. Just a lot of reports on assessment of local manufacturing. So if you want to find Kenyan water sanitation and hygiene, that is WASH in school strategy from 2024 to 2029, national cancer screening and early diagnosis guidelines, Kenya national guidelines for management of cardiovascular diseases, national clinical guidelines for management of diabetes mellitus. This was published in 2024. So you can just come here and look at them. So if you want to know more guidelines, you can just type and search you can say nutrition. I don't know. Yes. So I've searched for nutrition. Maybe it wants me to filter more, but yes. So this is basically what you can search and find what you need to know. So yeah. As we wind up, I'm just going to share with you helpful tips for using these tools efficiently. Always check the publication date. If you've noticed, I was mentioning a report or a paper, and also mentioning the date. So if you found a report or a guideline and you feel like it's outdated, go and do further research, compare with other websites, so that you can find like if there's new updated ones. Compare multiple sources before concluding. I have shared, I don't know almost how many. When you go to WHO, you find it. Go to FAO if they've done. Go to UNICEF. I know I've not added it, but the list was way long. But UNICEF is also another website you can check. Go to PubMed. Go to Google Scholar. Compare before you conclude. Like, this is my findings. I know guidelines, we want them to be universal, so do the same. Bookmark your favorite database for quick access. There's a place in your browser where you can add them to your bookmark. For me, I have folders. I have folders that I've labeled them. So if it's an interesting, curious research paper, I will add it there, and then I will come and read it later. And then don't overwhelm yourself. Start with one or two. Let's say WHO is the common one. Start with it, go through it, and then go to Google Scholar, because it's easily accessible. Do your research, navigate, get to know them before you start going to those other many things, so that you don't feel overwhelmed. As I wind up the episode, thank you so much for staying till the end. Thank you so much for watching. Today I've shared with you my go-to tools. We've looked at ASPEN, ESPEN, we've looked at Google Scholar, PubMed, FAO and WHO Resources Center, NutriSurvey, and just some of the Kenyan national guidelines, among others. Please try any of these tools this week. Come to the comment or DM me. Let my community know you guys are benefiting from what I'm telling you guys. And if you like, in the next episode, maybe I'll walk through how to actually use this tool to build a client meal plan. Let's say like NutriSurvey. I didn't talk about chronometer. I didn't talk about my fitness pal. Those are things that can be able to help your client track this. So I feel like maybe I'm in the techie mood kind, and I like these videos because I don't have to do too much, but you guys still get what I want to share. So don't forget to subscribe to my YouTube channel, follow me on all my social media at Charity Safe Haven, and leave in the chat box, is this episode helpful? Do you like more of this episode, or do you like the ones I show my face? Please let me know so that I can plan on what to do next. So until next time, I've been yours. Bye.